Hey everyone, so today we're going to be talking all about Hara diagnosis. I'm very excited for this subject, so we're going to get straight into it. Now, please make sure to like and subscribe, hit the little bell to be notified of more videos coming out about Japanese medicine every single week. I do go live here on this platform every single Wednesday at somewhere in between 5 to 6 p.m. Mountain Standard. So if you want to tune in for that, I would love to talk to you about it. Hey Jen, how are you? Okay, so today we're going to be talking again all about Hara diagnosis. First, let's talk about exactly what Hara diagnosis is and how Hara diagnosis can actually be better than your pulse or your tongue diagnosis. So as you all know, probably with your TCM education, usually in TCM, you take the pulse, you look at the tongue, which you probably could tell what's going on in my body from that, and then you go on with your what you're going to treat, what's wrong in their body, spleen deficiency, liver excess, all this other normal TCM stuff. So where Japanese medicine came from, Japanese medicine actually developed from a very different lineage. Specifically, that Japanese actually, the acupuncturist massage therapists actually were originally blind. So whereas in China, most of the practitioners were with sight, and in China, socially, you weren't able to touch or feel the body. In Japan, all of the practitioners, for the most part, were blind. And so, in order to diagnose the body, they could take the pulse, but it was very difficult for them to diagnose the tongue, which is why tongue diagnosis is not really emphasized right now in Japanese medicine. I mean, we take it into consideration, but it's definitely not at the forefront of our diagnostic skills. What we do, however, a commonality of all Japanese medicine styles, hands down, all styles, including Kampo medicine, is palpation, and in particular, the palpation of the Hara. Now, the Hara diagnosis, to stand up and show you, it can mean one of two things. So it can either mean literally the Hara, which literally means stomach. So from the rib cage down really to the pubic symphysis. But in other styles, it can also mean the chest, abdomen, and really the palpation of the rest of the body. So, how this acupuncture diagnostic style can really benefit your practice, whether you're doing herbs, moxibustion, or acupuncture, or all three, is that it's going to physically tell you what exactly is happening in the body. So, I want to give you a few examples of this. I'm not going to go too far into it. If you would like to learn more, I'm sorry, I have Kindle versions of these books, so I can't show you the actual book. There's some really good books written by Nigel Doss. One in particular that I really love is Kampo, Kampo, and I'm going to go ahead and put that one in the chat. So it's called Kampo. It's Otsuka Keisuke's book. Otsuka's book. Yes, he is amazing. So Nigel Doss actually did, with a few other people, he translated that book and then gave a little bit of commentary. Now, I really like this book because Otsuka Sensei is considered one of the foundational members of Kampo. Now, Otsuka's traditional take on Kampo is a little bit different than some other styles. But in general, I think it gives you a really, really good opportunity to kind of understand what things are happening. Now, another really good book to reference is, of course, an English copy of the Shanghanlun. Now, the reason why I'm saying the Shanghanlun, I know a lot of people here are like, why the Shanghanlun for acupuncture or moxibustion, is the discussion of colon damage, or the Shanghanlun. In particular, I like the text written by Guahui Lui. Oh, I'm so bad with Chinese. I'm just going to put it in the text. So sorry if I butchered that name. I'm pretty sure I did. So it's a discussion of cold damage by Guahui Lui. So the reason why I really love this text in particular in English is because he starts to reference a lot of the Japanese practitioners and how they found actually the Kampo, or that herbal diagnostic that's written in the Shanghanlun, physically on the body. So let's talk about a few of those and how you can start to integrate that into your practice. And then we'll talk a little bit about how it can be more beneficial sometimes than your tongue or your pulse diagnosis. So in particular, we're going to talk about, let's talk about 3 or 4. So the first one is called Kyokyo Kuman, and I'll put these all in the chat. So Kyokyo Kuman is literally this area of the rib cage. So here's my rib cage here. And I have a quite wide arch here for my rib cage. But this area of the rib cage and the stomach, where the diaphragm is, of course, separating the abdominal cavity from the lung cavity. Now, a typical chai hu presentation, let me move this back a bit. A typical chai hu presentation to confirm that it's a chai hu formula is that you're going to have kyo kyo kuman. Now, the degree in which you have kyo kyo kuman can be different, but essentially what kyo kyo kuman really means is that this whole area from the beginning of the rib all the way over here where this diaphragm can be really felt through palpation. And so normally you should be able to get your whole hand under the rib, is that you're not able to get your hand under the rib because there's a lot of resistance here in the diaphragm in particular. And that can be on both the left and on the right side of the diaphragm. And those can actually mean slightly different things. But in general, this kyo kyo kuman against, I forget what they call it in English. Maybe it's resistance of the diaphragm or something. It's in that Kampo book. This kyo kyo kuman is very, very stereotypical of any chai hu formula. And so whenever you go into your chai hu, any formula that's based on chai hu, if they don't have that kyo kyo kuman, what essentially that means is the Japanese Kampo practitioner, that Japanese herbal practitioner, is going to rule out chai hu formulas and therefore chai hu formula presentations for both acupuncture and moxibustion treatment. Now, when it comes to acupuncture and moxibustion, there's not many actual styles of Japanese medicine that refer back to the Shanghanlun in particular, but many of the styles do reference the actual Kampo related Hara diagnosis findings. Now, there's a bunch of different styles of Hara diagnosis. It's evolved greatly throughout the years. I'm not going to really get into specific findings. Let's just talk about some really basic ones. So another one that is super basic is going to be Shinka Hee or Shinka Hee Ko. Now, I'm going to say something, I'll put this in the chat, Shinka Hee or Shinka Hee Ko. Now, I'm going to say something that varies a little bit from what Nigel Dawes teaches. So if Nigel ever watches this, if you are watching Nigel, I understand that we disagree at this one little point. However, Shinka Hee and Shinka Hee Ko is essentially distension in this epigastrium region. So here I have the tip of my sternum and I have my rib cage, right? And then here is going to be the area of my physical stomach. And then, of course, it's going to feed into my small intestine and large intestine, all that good stuff. So whenever someone has oppression here, when they feel like there's something here in their stomach, or when you can push on here in this area right below the sternum, and it feels very hard and I don't want to say distended, it feels hard and almost compact, that is Shinka Hee. And when the practitioner and the patient both feel that it's very hard, and a lot of times the patient will say, like, I just, like, my stomach is always hurting, and they always kind of like push on their stomach right here below the sternum. That is the difference between Shinka Hee and Shinka Hee Ko. In Shinka Hee, and I should probably look up this English translation for you while I talk. So sorry if I'm looking at the screen a little bit. I'll just kind of look up the English translation while I'm talking really fast. Shinka Hee is going to be more about the practitioner can feel it, but the patient doesn't really notice it as much. Now, this is a little different than, of course, Nigel Dawes's recommendations, but that's how I learned Shinka Hee. Now, in Shinka Hee Ko, that's when both the practitioner and the patient, again, can feel that obstruction. There we go. That's the word, obstruction in that epigastrium region. So how that's going to really translate to make this diagnosis, like, okay, I found these things. So what? Big deal, Maya. Like, how is that actually going to help me over and above my pulse diagnosis and my tongue diagnosis? Well, let's just first talk about the faults with the pulse and the tongue. So first off, the fault with the pulse is that when someone sneezes, the pulse changes, right? Like the pulse is so significant and so easily changed. And if they're on any kind of medication, for example, prednisone, it often makes the pulse quite wide and large and floating, even though they shouldn't have that pulse. I've noticed a lot of biologic medicines, for example, UC, they make the pulse quite tight and hard. So those medications can really change the pulse and therefore change your finding. Now with the tongue, of course, if they've drank coffee that day, if they brushed their tongue, Also, long-term chronic, I shouldn't say chronic, but medications that they've been taking for a long time. Those are, of course, going to affect the tongue as well. And it's going to change our diagnosis, right? Because they're going to give you a little bit other information that you shouldn't be basing your diagnosis on, possibly. So there's a lot of faults with the pulse and the tongue. Now, in Japanese medicine, the Hara, again, that chest and abdomen palpation is considered queen. And she's considered queen because she doesn't change as easily as the pulse and the tongue. It actually takes a lot to really change the Hara diagnosis. And so when you palpate, let's say again, that Kyokyo Kuman, which is again this um, tension here in the diaphragm, and I believe it's translated a little bit different in Nigel's book, but that obstruction and tension along the diaphragm, not only can you say, okay, this is definitely a Chai-Hu based formula, but now you can say, okay, there's something to do with liver based in this person's presentation. And then you can go backtrack from there and say, okay, why is the liver in excess? Or why is the liver key stagnant? Like, what is happening, and how can I now use my acupuncture and moxibustion to change that? Now, of course, if you're doing TCM straight theory, you might just go straight to liver 3 or liver 14 and do something very simple. That's totally fine. If you're doing a Japanese medicine theory, depending on your style, you might go to the liver shu. And then you also might go to something completely different. Depending on your style, like approaches completely change. For me in particular, I would do a very quick contact needling along, just to show you again, along this area, along the rib cage, in order to quickly disperse. Because as I said in my last video, quick, shallow, and many, of course, is the stereotypical classical way to treat dispersion. And then slow, deep, and few is how you tonify, right? So I would do a very quick dispersion contact needling technique that might, I don't have a needle in my hand, but it might look something very quick and easy like that. Now, if I was to do something for Shinka Hee or Shinka Hiko, again, that obstruction in the epigastrium that's either felt by just the practitioner or you and the patient, I would more than likely say, okay, what's going on in the stomach and why exactly that's happening? Now, a really easy way to think about this is a patient with morning sickness. I see Shinka Hee and Shinka Hiko very frequently in morning sickness patients. More, I say often than not, than the Shinka Hiko is usually presenting. And often than not, they have one of two presentations, right? They have too much heat in their stomach, excess heat, or they have excess cold. And if they have the excess heat presentation, then they have to eat all the time. And if they have the excess cold presentation, they can't eat anything. And so it's a very stereotypical presentation. Also within that, though, the Shinka Hiko is literally written as obstruction below the heart or glomus below the heart, which is not really a word, but it essentially means obstruction. And so it's actually related very closely to anxiety. So whenever I see someone who has Shinka Hee and Shinka Hiko, especially with morning sickness, you have to be very cognizant about what is happening in the anxiety range of that client, right? Do we have to work around the REN 17 and the kidney areas up here like a more 5-element approach in the Western kind of approaches? Do we need to release the Taiyang? Do they have very tight shoulders and are working on a computer all the time? Excuse me, talking too fast. And then if they have an excess presentation in their stomach, do we need to do a one needle that goes into where their excess heat is and pulls it out quite quickly? Or do we need to do a needle that is retained a little bit longer? For example, this is a great place to do your retention of needles for that 20-minute period where most TCM practitioners lie, right? They do place their needles for 20 minutes and then come back. So that would be a great place to retain a needle, which would be someplace probably REN 13 to REN 15, sometimes even down to the area of REN 12. It would also be a great place to either do dispersive moxa or tonifying moxa, right? So for that excess heat, we can do dispersive moxa, which is of course a hot moxa cone that doesn't leave a burn. And we can do that again where we're feeling the most excess, the most heat. Or we can do several moxa cones, or even you could do needle top moxa, or you could do pole moxa. I'm not much of a fan of that, but you could do pole moxa in order to really tonify that area, right? In order to bring it back to life and help the stomach to work again in the case of morning sickness. And you could also see, of course, Shinka Hee or Shinka Hiko in patients who strictly are just super stressed out. So all of these kinds of presentations can really be beneficial for you because not only do they give you the full aspect of what's been happening chronically for this client's history, but it can give you a really quick and easy approach that you can follow your hands to treat rather than following a protocol for, let's say, spleen qi deficiency, right? You can now start really trusting the body. And how I teach my students this when I teach at the local acupuncture school, I say, look, you can really have two approaches with your Hara diagnosis. One is you can rely on your TCM and say, okay, there's Shinka Hee, again, that obstruction that the patient and you both feel below the epigastrium that's related to the heart. Okay, so for that, it's more anxiety driven more than likely. So I'm going to retain it REN 17, and maybe I do the heart shoe, and maybe I retain it like REN 12 or something because the stomach's not functioning. So you can, and maybe like stomach 36. Most TCM practitioners wouldn't do spleen 6 on a pregnant woman, but so you could do something very protocol like that, or you can literally treat what you see with your hands and what you palpate with your hands. And so like I was saying, you could do a quick contact needling for Kyokyo-kuman, or you could do a very quick needle for an excess heat type for this Shinka Hee or Shinka Hiko, or you could retain where you feel the most deficiency in cold with the Shinka Hee and Shinka Hiko, and maybe tonify a little bit where you feel there is deficiencies along perhaps the kidney or REN 17-ish area, and also relating to the bladder as well. And in the similar like bladder 44, heart, shoe kind of areas, right? Pericardium and stuff. So there's two different approaches to that. But really, when it comes down to it, your Hara diagnosis is so beneficial. And so what I really suggest you do, because again, I can't do a full diagnostic class on Hara diagnosis on a quick YouTube live. I highly suggest that you get some books from from Nigel Doss. There is another person who has some really, really good books on that. Let me just look up his name one more time. If it'll come up. Oh, his name's not popping up. Bummer. I'll put in the chat later on that doctor's name. That's it. Dr. Butch Levy. Dr. Butch Levy, and I'll put that in the chat, has some really great, easy to read books on Kampo and specifically Hara diagnosis, ones that are more like bedside related books. One of them especially is quite thin. It's just super easy to read. I really like his approach to the medicine, and he just has a very practical application. So I highly suggest checking his books out as well. They're very good. And then, of course, checking out the Sheng Hanlun when you're ready to go into a little bit more deep study about what Hara diagnosis is and how it can be applied to both your herbal medicine, acupuncture, and your moxibustion. Okay, so that's all for today. I hope that you learned why it's important, how you can start implementing it, why it can be a little bit more beneficial than your pulse or tongue. And of course, Hara diagnosis, if you don't see the same diagnosis with the pulse, tongue, and the Hara, always rely on the Hara diagnosis. She never lies. Really, the Hara is always queen. The pulse and tongue can lie quite frequently. So you always want to rely on that if they're different diagnostics. So why it's important, how you can start implementing it, and of course, ways to start learning a little bit more, at least through books. Now, if you're interested in taking some of this information and taking it to the next level, I highly suggest joining ShinKyu University. Hara diagnosis is something that I brush upon in the course, and then I really start to emphasize when we're in-person classes. So if you're interested in taking one of those in-person classes, I do have some coming up. And then also ShinKyu University is a lifetime membership and mentorship course. So I highly suggest joining that to give you a little bit better information and also to guide your practice going forward. All right, so that's it for today. Please don't forget to like, subscribe, and hit the little bell to be notified more about all things Japanese medicine. I really loved learning with you today. And if you have any questions, please do put them in the comments below. I would love to answer them for you if I can. All right, everyone, you have a great day. Hope you had a good day at practice, and I'll talk to you and learn with you soon.